Have you ever stopped to wonder whether the medicines that have protected your health for years are still working the same way today? It sounds like a simple question, but for many adults over the age of 60, the answer is more complicated than most people realize. Many people believe that if a medication has worked well for years, there is no reason to question it. The prescription hasn't changed. The dosage hasn't changed. The daily routine feels familiar and reassuring. But there is one important detail that often goes unnoticed. Your body has changed. As the years pass, your liver becomes less efficient at breaking down medications. Your kidneys may take longer to remove them from your body. Your blood vessels become less flexible, and your heart has to work harder than it once did. These changes happen gradually, often without causing pain or obvious symptoms, yet they can completely change the way your body responds to the very same medicine you've been taking for years. That doesn't mean your medications are suddenly dangerous. Far from it, many of them continue to save lives every single day. The real question is whether they are still the right medications at the right dose for the body you have today rather than the body you had 10 or 20 years ago. What surprised me most while exploring this topic was discovering that some of the greatest risks don't come from taking the wrong medicine. They come from taking the right medicine without ever stopping to ask whether your changing body now needs a different approach. In today's video, we'll explore why this happens, which commonly used medications deserve a second look after the age of 60, and, most importantly, what practical steps you can take to protect your heart without making unsafe decisions on your own. Because before we talk about any specific medication, there's one important change happening inside your body that almost every older adult experiences, and understanding it may completely change the way you think about every prescription in your medicine cabinet. Before we talk about any specific medication, it's important to understand why the same prescription can affect you differently at 65 than it did at 45. Many people assume that if a medicine hasn't changed, its effects won't change either. But your body isn't frozen in time. It continues to evolve throughout your life. And those natural changes influence how every medication is absorbed, processed, and eliminated. One of the first organs to change is the liver. The liver is responsible for breaking down many of the medicines you take every day. As we grow older, blood flow to the liver gradually decreases, and some medications remain in the body longer than they once did. A dose that was perfectly appropriate years ago may now produce stronger or longer-lasting effects. The kidneys also deserve attention. Their job is to remove waste products, and many medications from your bloodstream. Beginning later in life, kidney function often declines gradually, even in people who feel perfectly healthy. Because this process is usually slow and painless, many people never realize that medicines may be leaving their bodies more slowly than before. At the same time, your cardiovascular system is changing as well. Blood vessels naturally become less flexible with age. The heart may have to work harder to circulate blood throughout the body, and even small increases in blood pressure or fluid retention can place additional strain on an already aging cardiovascular system. There is another change that often receives far less attention. As we age, we are also more likely to take several medications at the same time, a prescription for blood pressure, another for cholesterol, something to ease joint pain, perhaps medication for acid reflux or occasional trouble sleeping. Individually, each medicine may be appropriate. Together, however, they can influence one another in ways that deserve regular review. This is exactly why healthcare professionals often recommend reviewing your medication list at least once a year, especially after the age of 60. The goal isn't to stop treatment. The goal is to make sure every medication is still helping more than it's harming. Now that we understand why the body changes, let's look at one of the most common situations that quietly places extra stress on the heart. Surprisingly, it often begins with medicines that millions of people consider completely routine. Now that we understand why medications can affect the body differently with age, let's look at two common types of medicines that seem completely unrelated but share one important characteristic. Both can quietly place extra strain on your heart and blood vessels, especially if they're used without regular review. The first group includes nonsteroidal anti-inflammatory drugs, often called NSAIDs. Medicines such as ibuprofen and naproxen are widely used to relieve arthritis, back pain, muscle soreness, and other everyday aches. For many people, they provide fast and effective relief, which is exactly why they become part of a long-term routine. The challenge is that these medications do more than reduce pain. They can also affect how the kidneys regulate sodium and water. When the body begins to retain extra fluid, blood pressure may rise, and the heart has to work harder to circulate that additional volume. For someone in their 20s or 30s, the body may compensate with little difficulty. After the age of 60, however, the cardiovascular system often has far less reserve. The second group may surprise you because most people don't think of it as a heart-related medication at all. These are common cold and sinus remedies that contain ingredients such as pseudoephedrine. Their purpose is simple. They reduce nasal congestion by narrowing swollen blood vessels inside the nose, making it easier to breathe. The problem is that this effect isn't limited to the nasal passages. Blood vessels throughout the body can also become narrower. As a result, blood pressure may increase, the heart may beat faster, and the cardiovascular system must work against greater resistance. If someone already has high blood pressure, coronary artery disease, or heart failure, this additional strain may become much more significant. What makes these situations especially important is that they often happen together. Imagine someone managing arthritis with an over-the-counter pain reliever who then catches a seasonal cold and adds a decongestant without thinking twice. Neither medication may seem alarming on its own, yet together they can increase the workload on an aging heart. This doesn't mean you should avoid these medicines altogether. In many situations, they remain appropriate and effective. The key is to use them thoughtfully, especially if you already have cardiovascular risk factors or take several medications every day. Even over-the-counter products deserve the same careful attention as prescription medicines. But not every medication affects the heart by raising blood pressure or making it work harder. Some create changes so gradual that they can go unnoticed for months or even years. And those hidden effects are exactly what we'll explore next. Not every medication affects the heart by increasing blood pressure or making the heart pump harder. Some work in a much quieter way, gradually changing the environment inside your body until small differences begin to matter more than most people would expect. Let's begin with a group of medications known as proton pump inhibitors, or PPIs. Medicines such as omeprazole and esomeprazole are commonly prescribed to treat acid reflux, stomach ulcers, and chronic heartburn. For many people, these medications bring tremendous relief and significantly improve their quality of life. However, stomach acid plays a much larger role than simply digesting food. It also helps your body absorb important nutrients, including magnesium, vitamin B12, and, to some extent, calcium. When acid production is reduced for a long period, the absorption of these nutrients may gradually decline in some individuals. Why does this matter? Magnesium helps regulate normal heart rhythm and supports healthy muscle function. Vitamin B12 contributes to healthy nerve function and the production of red blood cells, which carry oxygen throughout the body. When these nutrients become deficient over time, the effects may not be obvious at first. Instead, they can develop slowly, making fatigue, weakness, or changes in overall health easy to mistake for normal aging. That doesn't mean everyone taking a proton pump inhibitor will develop these problems. Many people benefit greatly from these medications. The important question is whether the medicine is still needed at the same dose and for the same duration. A simple conversation with your healthcare provider may help determine whether continuing treatment, adjusting the dose, or exploring other options is the most appropriate choice. Now let's look at another group of medications that can influence health in a very different way. Benzodiazepines, including medications such as diazepam and lorazepam, are often prescribed for anxiety, insomnia, or certain neurological conditions. They can be very effective when used appropriately, but as we grow older, our bodies often become more sensitive to their effects. These medications may remain in the body longer than they once did, increasing the likelihood of daytime drowsiness, slower reaction times, reduced physical activity, and a greater risk of falls. They may also worsen existing sleep-related breathing disorders, such as obstructive sleep apnea. In some individuals, although none of these changes directly cause a heart attack, they can gradually influence cardiovascular health by reducing physical activity, lowering oxygen levels during sleep, and making recovery from everyday physical stress more difficult. The good news is that these risks can often be managed through regular medication reviews, careful dose adjustments, and open communication with your healthcare provider. The goal is never to stop treatment on your own, but to ensure that every medication continues to match your current health needs. So far, we've talked about medicines that increase cardiovascular strain and others that quietly change the body's internal balance. But the next medication is different. It's one that millions of people take every morning believing they're protecting their hearts, even though today's medical recommendations are far more individualized than they were just a few years ago. Imagine starting every morning with the same small routine. You wake up, pour yourself a glass of water, and swallow one tiny pill because you've always believed it was helping to protect your heart. For millions of older adults, that pill is low-dose aspirin. For many years, taking a daily aspirin was considered one of the simplest ways to lower the risk of a first heart attack or stroke. Doctors often recommended it, family members encouraged it, and many people continued the habit for decades without ever questioning whether it was still the right choice. But medicine doesn't stand still. As researchers gathered more evidence, they began to discover something important. While aspirin can reduce the formation of blood clots, it also makes it more difficult for the body to stop bleeding. As people grow older, the balance between those two effects changes. Blood vessels naturally become more fragile with age. The lining of the stomach becomes more vulnerable, and the risk of internal bleeding gradually increases. For someone who has already experienced a heart attack, an ischemic stroke, or certain cardiovascular conditions, the benefits of aspirin often continue to outweigh those risks. In those situations, aspirin remains an important part of treatment for many patients. However, for adults who have never had a heart attack or stroke, the decision is no longer as straightforward as it once seemed. Current medical recommendations place much greater emphasis on individual risk rather than a one-size-fits-all approach. Factors such as age, overall cardiovascular risk, history of stomach ulcers, bleeding disorders, kidney disease, and the use of other medications all become part of the conversation. That's why one of the most valuable questions you can ask isn't, should everyone over 60 take aspirin? Instead, ask, is aspirin still appropriate for me? That simple question invites a much more meaningful discussion with your healthcare provider and ensures the decision is based on your personal medical history rather than outdated advice or information you've heard from friends online. This idea applies far beyond aspirin. Every medication we've discussed today serves a purpose. Pain relievers help people stay active. Acid-reducing medications relieve chronic discomfort. Medicines for anxiety and sleep can improve daily life. Aspirin can be life-saving for the right person. None of these medications are inherently good or bad. The real issue is whether each one still matches the body you have today. And once you begin asking that question, your focus shifts from simply taking medication to actively managing your long-term health. That's where the next part of our conversation becomes the most practical, because protecting your heart doesn't begin with adding another prescription. It begins with knowing the right questions to ask before your next medical appointment. We've covered how certain medications may affect the body differently as we age. Now the question becomes much more practical. What should you actually do with this information? The answer isn't to throw away your medications or become afraid of every prescription in your medicine cabinet. The goal is to become an active partner in your own healthcare by asking the right questions and paying attention to the signals your body may already be giving you. The next time you visit your healthcare provider, consider bringing an updated list of every medication you take. That includes prescription medicines, over-the-counter products, vitamins, herbal supplements, and even medications you only use occasionally. Many interactions happen because one product is added without considering everything else that's already part of the daily routine. Then ask 3 simple questions. The first question is, do I still need this medication at the same dose? Our health changes over time. Weight, kidney function, liver function, blood pressure, and even activity levels can all change over the years. A medication that was appropriate a decade ago may still be beneficial today, but the dose or treatment plan might deserve another look. The second question is, are any of my medications working against each other? This is especially important if you're taking several medications every day. Sometimes one medicine can reduce the effectiveness of another or increase the likelihood of side effects. A regular medication review gives your healthcare provider the opportunity to identify those issues before they become larger problems. The third question is there a safer option based on my current age and health? Medical research continues to evolve. New treatment options become available, guidelines are updated, and recommendations change as more evidence becomes available. Having this conversation doesn't mean your current treatment is wrong. It simply ensures you're benefiting from the most appropriate care today. There is also a simple habit you can develop at home. Pay attention to small changes instead of waiting for dramatic symptoms. Have you noticed your blood pressure creeping higher than usual? Do you feel dizzy when standing up? Are your ankles swelling by the end of the day? Do ordinary activities leave you more short of breath than they did a few months ago? Have you started taking a new over-the-counter medication without mentioning it to your doctor? None of these signs automatically mean something is seriously wrong. In many cases, they have simple explanations, but they are valuable pieces of information that can help your healthcare provider determine whether a medication, a dosage, or another health condition deserves closer attention. One of the most helpful habits is to keep a small notebook or use a notes app on your phone. Record your blood pressure readings if you monitor them at home. Write down new symptoms when they started and whether they appear after beginning a new medication. These observations often provide a much clearer picture than trying to remember everything during a medical appointment. Small observations lead to better conversations. Better conversations often lead to better decisions. And over time, those better decisions can make a meaningful difference in protecting both your heart and your overall health. That brings us to one final idea I'd like to leave you with before we finish. Before we say goodbye, I'd like to leave you with one personal thought. The more I learn about healthy aging, the more I realize that good health isn't about finding one perfect medication or one miracle solution. It's about paying attention to the small changes that happen over time and being willing to ask better questions as our bodies change. If there's one lesson I hope you take away from today's video, it's that medications should never be viewed as permanent decisions. They should be viewed as tools that deserve regular review. A treatment that was exactly right years ago may still be right today, or it may simply need a small adjustment. The only way to know is through an open conversation with a healthcare professional who understands your medical history. Personally, I believe that staying informed is one of the most valuable things we can do for ourselves and for the people we love. The goal isn't to become afraid of medications. The goal is to understand them well enough to use them wisely. If today's discussion encouraged you to think differently about your own health or reminded you to review your medications with your healthcare provider, then this video has achieved exactly what I hoped it would. Before we finish, I'd like to share one important note. The information presented in this video is intended for educational and informational purposes only. It is based on publicly available medical research and current clinical guidance available at the time this script was prepared. It should not be considered personal medical advice, a diagnosis, or a substitute for consultation with your physician, pharmacist, or another qualified healthcare professional. Every person has a unique medical history, different health conditions, and different treatment goals. For that reason, never start, stop, or change any medication based solely on information from this video. If you have questions about your prescriptions or your personal health, please discuss them with your healthcare provider, who can evaluate your individual situation. Thank you for spending your time with me today. If you found this video helpful, please consider sharing it with someone you care about, especially a parent, family member, or friend over the age of 60. And if you'd like more evidence-based discussions about healthy aging, heart health, and practical ways to stay well as you grow older, I'd be honored to have you join me in future videos. Until next time, take good care of yourself, stay curious, and remember that the best health decisions are made through knowledge, thoughtful conversations, and regular medical guidance